Okay, hi, I'm Dr. Joel Levy, Mission Move Physical Therapy. This is another one of my episodes on my knowledge bombs, knowledge nuggets, things I talk to my patients about almost daily. So here I have on the board written, wow, that feels great, okay? So let me explain this. Let me paint a little scenario for you. So let's say that you wake up with a crick in your neck and you ask a loved one to rub your neck, right? And let's say this person that you trust, a spouse, family member, friend, somebody, isn't any kind of healthcare provider at all. Let's say they're, I don't know, an engineer, an accountant, something. And they rub your neck, and as they do, they might just spend 5 minutes on there kind of going like this. And then when they're done, you turn your head and you're like, you know, I can turn my head a little bit further now. And you're like, wow, that feels great, thanks, right? And so the question is, why did that happen, right? Why, when somebody who's not a skilled person rubs your neck, does it feel better? And the reason you ask why is because a lot of times people, if they do see a healthcare provider and they do something to them, right? Like, let's say you go to see a massage therapist and you trust them, they're highly skilled, they're someone you've seen for a while, and as they're doing this, or a physical therapist, a chiropractor, somebody, and as they're doing this to your neck, they're like, well, I'm on this muscle and I'm on a trigger point and I'm breaking this up, right? You kind of believe the things that they're telling you, that they're, you know, that they're highly skilled in what they do. And interestingly enough, you actually get a very similar effect from somebody who has no skill at all. So what actually happens to the tissue? What causes your neck to then gain range of motion with only 5 minutes of somebody on the outside of your body just kind of massaging your muscles? So I go into this for a lot of reasons to kind of teach people a little bit how the body works neurologically through what we call systems of sensitivity and kind of a system of threat. So when you wake up with a stiff neck, and this works in a variety of bodies, this is body parts, just best understood in the neck, your range of motion is limited because your brain is limiting it, okay? Meaning, like, as you turn your head, it's kind of sore, and it's not exactly sure as to what triggers this, but again, maybe you just stayed in a prolonged position for too long, but as you go to turn your head, the brain's like, you know, like that, we're a little sensitive to that. We're a little threatened by that movement, and so let's send out some stimulus to get it to stop. And so it basically stops your head from turning as far. Now, if you still have the same range of motion at the tissue level, meaning like your muscles didn't actually get any smaller, it's that they're being inhibited neurologically from your brain, okay? So then when somebody you like, right, wouldn't be someone you don't like, has to be someone you trust, right, family member, friend, or whatever, comes and rubs your neck, the brain then interprets that input as good, right? It's like, that feels good, right? Feels nice to have your neck rubbed, right? And so when your brain gets that sensation, then it's less threatened, and then it becomes less sensitive. And when that sensitivity decreases, then the brain less inhibits the tissue, right? Less inhibits that motion, less inhibits that stimulus of maybe a painful stretch, and then it allows you to turn your head more, okay? So I teach this to my patients a lot just to teach them that how the body works, right? And that a lot of times when you have something that's kind of painful and stiff, things didn't actually become, especially if it's like an acute type of injury or something has happened, and your tissues didn't actually become shorter physically, and that by doing some of this sort of passive treatment that a lot of different practitioners do, that we can increase the range of motion. And that's a lot of how it works, right? So that's the answer to why something feels good, right? That something works like that. It's actually just your neurological system becoming less sensitive so that you can move a little bit more. And then, of course, as physical therapists, we always want to do some activity on top of that, because that's actually what makes it last longer. So instead of just getting some passive treatment and then going about your day, a lot of times your effects aren't as lasting. If we can actually get some muscle activity and some contraction in that new range, then you'll have longer effects. So a lot of times the reason I'm telling you this is just like it's a way of educating you on what happens when people actually are performing some treatment to you. And the more people understand this, they can make good informed decisions on what kind of treatment they get and what they should be doing after the treatment. So this is a little bit more difficult concept to understand, but if you have any questions or would like to know more information about that, please ask.